Hi everyone, Kelly here. I'm going to start this week's learning off with a discussion about the importance of health research. Health research has led to significant discoveries, the development of new therapies, and a remarkable improvement in healthcare and public health. Health research can provide important information about things like disease trends and risk factors, outcomes of treatment or public health interventions, patterns of care, healthcare costs and use, improvements in life and health standards, life expectancies, and overall reduction in mortalities. Research has promoted a number of innovations in global health. For example, vaccines have been developed against many infectious diseases and have managed to eliminate smallpox and almost eliminate polio. The number of deaths from measles was reduced by 78% in the period from 2000 to 2008 as a result of improved routine immunization and regular vaccination campaigns. The introduction of newer vaccines against pneumonia and diarrhea are together expected to save a further 1 million lives annually in the poorest countries. The great thing about medical research is that it never slows down. It's impossible to discover everything all at once, so there'll always be new discoveries and new ways to improve healthcare. There are people working in labs right this minute poring over research data. Every day there could be a new discovery being made. We think things are good right now, but imagine what research could bring us in the future. So let's have a look at the dental profession. The changes that have occurred in the dental profession over the past 70 years have been transformational. Fluoridation of the water supply has been identified as one of the top 10 public health initiatives of the 20th century and has resulted in 30 to 50% reduction in dental caries. With so many changes, here are some fun and notable highlights. For example, in 1950, the first fluoride toothpaste was introduced to consumers. In 1957, the first high-speed air-driven contra-angle handpiece was invented, which greatly increased the speed of dental services. In 1958, the first fully reclining dental chair was introduced. In 1960, the first electric toothbrush was developed in Switzerland and marketed to U.S. customers. Also in 1960, lasers are first approved for soft tissue use in periodontal disease. In 1971, hygienists are allowed to wear pants at work. In 1989, the first at-home tooth bleaching kit is introduced to consumers. There have been sweeping technological innovations that have changed almost every part of oral health care. Research with advanced nanomaterials, advances in imaging and diagnostics, refined use of lasers and composite materials, and ever more refined tools and techniques for improving patient comfort and compliance have most certainly impacted the dental hygiene practice. As with any other health profession, research is critical to the profession of dental hygiene. Timely, accurate, and relevant research is essential to guide the growth and development of the dental hygiene profession and to ensure that practices and policies are evidence-based and support the goals of good health for all Canadians. In this course, you will gain some basic understanding of research and stats. We're going to examine research methodologies, data collection, research design, bias, and research ethics, so you're able to critically appraise your research paper, understand credibility, validity, and ethical research, and then integrate that into the best possible decision-making and client care for your clients.